Sorry, was that a question?
Snake, no.
Or was that? No?
No.
Okay, maybe that was just a. Sorry, we heard something in here, so we just weren't sure.
You want to click on to unmute themselves if they want to ask questions.
Yeah, they can unmute.
And click it.
There we go. All right, and then just close that. And then we also have the ability to do, yeah.
Software for cell analysis of these images.
Yes.
For brain. So I don't know if you want to talk about that, like what type of, do you have all the software that are required, or we have to, for example, if we want to do analysis, we have to add purchase for the software.
Sure. So the question, if everybody didn't hear, was about doing image analysis. It's actually something that we're still working on. Ultimately, since this is one of the core research facilities, I think we probably are going to try to move towards having individuals throughout the university who can help with things like image analysis, especially for people who are not as familiar with doing it. What's kind of good about image analysis is that most of the software programs are kind of freeware. So, usually for either a very nominal price or, just to be able to connect to it, people are able to use a variety of different analysis softwares. Sometimes they require training. So again, for somebody who's never done it before, probably hard to just suddenly start doing it. But for those people who have done it before, usually it's fairly available. But also what we're hoping to be able to do is to sort of be able to provide kind of from the image to the analysis, the entire package. At the moment, we don't have the formal ability to offer the analysis. But we do have people within our center, and we have people across the university we can kind of connect people with in order to do analyses, which obviously also is important. Part of the reason why it's also a challenge is that it may also depend on what you ultimately want to do. So if somebody wants to do imaging of joints, that's a whole, like we may need them to be able to do their analysis their way. Some of the brain imaging is something that we are able to do and can help provide for people. I lose this ability here. Thank you. Okay. So we do have the ability to look at a variety of these different. So for example, we can look at brain structure, and you can look at whether there's individual lesions here in the brain. We can look at the vasculature through something called MR angiography. As we'll talk about, we can look at a variety. This looks like it got a little out of order here. But we do have the ability to look at many different aspects when it comes to brain function. So we can look at things like cerebral blood flow in both normal as well as pathological conditions. So if you wanted to study people with depression or Alzheimer's, you could look at the changes in blood flow and look for certain patterns of activity. You can look at normal patterns, meaning that we can challenge people, get students to come in, and we can do different tasks to look at how they process emotions or how they do quantitation or whatever. So we can look at that both in normal as well as pathological conditions. And of course, the pathological conditions can include a full array of neurological, psychological, and in my life and career as an imager, I've had a great opportunity to be able to work with people in all the different domains to be able to look at this. Two of the main ways in which we look at brain activity is one is called BOLD imaging, the other is called ASL. So BOLD imaging stands for blood oxygen level dependent imaging, and it basically measures a signal related to the amount of oxygen that's in the blood. And this is extremely commonly used to look at activation studies. So you run a BOLD scan, and while the BOLD scan is being done, you give somebody a task. Maybe they have to solve a math problem, and then they rest, and then they solve it, and then they rest. A lot of times you do that as a block design, it's called. And so that gives us an opportunity to see what areas of the brain are activated when the person is doing that particular task. ASL, arterial spin labeling, is another way of looking at blood flow in the brain. It's a kind of clever way. So when you're doing BOLD imaging, you're kind of looking at the entire brain itself and the oxygen levels throughout the brain. When you're doing arterial spin labeling, you're actually kind of giving a pulse, a radio frequency pulse, which is part of how the whole MRI system works, at the level of the neck, and then you're watching the blood flow as it goes into the brain. Again, that can also be used for looking at blood flow related to pathological conditions as well as various activation studies. And activation studies are probably one of the most common types of approaches that are used, again, for just kind of learning how we as human beings do different things, but also how they may be affected by different diseases. So, for example, if you're doing a study of emotional processing, you might want to have healthy individuals to see how they do emotional processing, maybe of faces or something like that. But you then might want to get people who have depression and see if they're using the same areas of the brain and processing emotional responses and so forth the same exact way. What people have also come across is being able to use things like bold imaging to measure the variability of different structures and how they compare to each other. And this is something called functional connectivity. So what we do is we have a person just in there in the scanner and we have them just at rest, and we see how different parts of the brain are either operating together or operating differently. And that is also very useful, as we'll talk about, to look at different pathological conditions, normal conditions, the effects of different therapeutic interventions. Do they change the functional connectivity of the brain? So there's a lot that can be done with that. Diffusion tensor imaging is a way of looking at fluid diffusion in the brain, and this is frequently used to look at the sort of the structural connectivity in the brain, so the fiber tracts, and again, I'll show you some pictures of that, but it's looking at kind of the white matter, the tendrils that connect the different neural areas and neural pathways in the brain. That can be affected by different diseases, that can be affected by different interventions. We have magnetic resonance spectroscopy, MRS, which allows for the ability to look at different molecular signatures in the brain. There are some that we can do, there's some that we can't do. That depends a little bit on what you're interested in, but we sometimes can look at the amount of, for example, GABA in the brain, gamma aminobutyric acid, so certain neurotransmitters. You can look at other metabolites in the brain. So it depends a little bit on what you're interested in, but we do have the ability to do that kind of thing. We can look at a whole variety of different therapeutic interventions. So they could be, giving somebody, cognitive behavioral therapy. It could be giving them a medication. It could be doing brain games. It could be meditation. It could be, a whole variety of different interventions that you might want to look at. And also ways of trying to determine prognosis and directing therapy. So if people come in, we've been trying to do this with people, for example, with depression. Depression is not all the same. And so, is it possible that if somebody has depression and their frontal lobes are more active than somebody else, do they respond better to an antidepressant versus cognitive behavioral therapy or things like that? So we have a lot of possibilities as far as applications. Oops. So we have the ability to look at, again, different structural processes. The colors here actually represent the connectivity through diffusion tensor imaging. So, for example, the red areas are connecting left versus right, versus up versus down, and so forth. And so you can look at both structural connectivity as well as functional connectivity. You have the ability to look at just the brain structure. You can look at the central structures of the brain here, like the ventricles and so forth. You can look at whether there's atrophy in the brain. That can all be quantified. So there are different ways that you can do that. And so we have those abilities. Here is the arterial spin labeling kind of scan. So you can see the different colors represent the amount of blood flow. Usually here, the red areas are the more active, followed by the kind of the yellow, green, blue, and black. And again, you can look at this in a variety of different conditions, or you can try to have them activate through visual processing or something like that, and see how the brain is responding similarly or differently depending on the circumstances. So a couple of research examples. This is from my history of doing this kind of research, looking at MRI, just to give you all some thoughts and ideas. But again, there's just so many different ways of taking it. We've been very interested over the years. Concussions become a big thing for people to look at. And so we've looked at concussions, and some of what we've done is to look for interventions for concussions, but a lot of it is just, what does a concussion do? I don't know how many of you have ever had a concussion or had a family member who's had a concussion, but oftentimes they go in for the doctor, go to the emergency room or whatever, they get an MRI scan, and structurally they say everything looks fine. And then they send the person home, and then a month or two later, they still have headaches, they still don't feel well, their light is too strong for them. So what's going on? And maybe they get another MRI and it still looks normal, but there's something else that's going on that's causing problems. So being able to look at the more detailed changes that are going on in the brain during a neurological condition like injury could be something that's very important for us to be able to understand the process itself, and then also to try to understand how to manage that process. So here is a scan that we did of diffusion tensor imaging, where the red areas are areas that are abnormal overall in a group of concussion patients compared to healthy controls. And basically what you're seeing here is that there's all kinds of abnormalities here. So even though you can't see this in a kind of basic structural image, you can see this when you do diffusion tensor imaging, and you can get where the abnormalities are. They tend to be a little bit more in the back of the brain, but really, you know, all areas of the brain seem to be involved. So what this is suggesting is that even though you can't, you know, see it on a more gross level, you can see this on a kind of a more microscopic level, if you will, that you can pick up using the MRI through diffusion tensor imaging, and you can say, gee, you know, these people really have some significant abnormalities in their brain that help to explain why they have persistent symptoms. That's a huge issue when it comes to concussion. Some people have a concussion and then a week later they're totally fine, and other people have the same kind of concussion, and you know, months later they're still you know, really struggling and having all kinds of issues. So these are the kinds of things that we can begin to look at. We can start to correlate these changes with different changes in neuropsychological functioning. So we were looking at, I don't know how well you guys can see this, but there's at the bottom here, this little box where we were looking at neuropsychological tests like TRAILS, which is kind of a fancy connect the dots type of thing. And the faster you do it, the better your performance. So there were correlations between abnormalities in the functional connectivity, or excuse me, in the structural connectivity that we got with diffusion tensor imaging, and how people were doing on some of these tests. So it starts to, again, kind of build an overall understanding about what the disease process is and how it affects people. And then the next step would be, okay, so can we do an intervention to try to help people? And then do these kinds of changes start to improve? Can we start to see that on the scans themselves? Excuse me. We've done some other studies looking at different neurological conditions. So we've done some studies on multiple sclerosis through some of my work with the world of integrative medicine. Multiple sclerosis, if you don't know, it's a neurocognitive disorder. It's basically an autoimmune process that attacks the white matter. The problem with a lot of structural brain imaging is that it shows you that they have these lesions in the brain. But some people can be loaded with lesions and kind of be relatively okay. Somebody else can have a lesion just in the wrong spot, and then suddenly they can't move their leg, or they can't, you know, they have trouble with vision or something like that. And the end process here, while there's an immunological attack on the white matter tracts, that usually causes damage through something called oxidative damage, obviously a pretty common concept in the biological world. And so one of the thoughts has been over the years is can you give an antioxidant? And if so, is that something that could actually help these individuals? So we've been working with a molecule called N-acetylcysteine. Sorry. And what we have found in general is that when you look at functional connectivity in the brain, and when you look at different changes in the brain, that there are significant changes in a number of brain regions, the temporal lobe, particularly frontal lobe, caudate nucleus, that correlate with different changes that we can observe in the brain function itself. And then when you look at things like, sorry, here we go. So here was an arterial spin labeling study. So here you have a person who is receiving N-acetylcysteine, and on the top image on the left, and you can see that it's mostly kind of bluish. And then when they come back after receiving N-acetylcysteine for a couple of months, that it's at least more yellows and greens. So they've actually increased the amount of cerebral blood flow in their brain, which tells us that functionally their brain seems to be working a little bit better. When we look at the control individual who did not get the N-acetylcysteine, but just went through a control period, we don't see very much change. In fact, if anything, some of the areas that were previously red are actually a little bit lower in activity. So what we were showing ultimately is that there tends to be kind of a drift towards not functioning as well, and people just kind of going through the natural process of multiple sclerosis. Whereas if you give people N-acetylcysteine, it kind of wakes their brain up a little bit. And that was part of, you know, not only do we see this physiologically, but people say, yeah, you know, I had a little bit more energy. I felt like I could think better. I was, you know, a little bit more cognitively I had more cognitive abilities to do things. So again, these are the kinds of things that we can do and look at with fMRI. We did an insomnia study where we took people who have a lot of issues with sleep, and we gave them an intervention that involved kind of auditory and as well as vibratory stimulation. So, many of you, if you've ever had trouble sleeping, you put on some earphones and you listen to some nice, background music or waves or something like that. So clearly that can kind of improve the way your brain is responding and hopefully get you to sleep. Even vibrations. I mean, if any of you ever had kids, you know what do you do when want to get them to sleep? You put them in the car, right? Because you got the vibration and the noise or something like that. People fall asleep on a plane, on a train. So the thought was, can we show that? Can we potentially see whether that might be effective for people? And basically, when we looked at functional connectivity, we see a lot of changes going on in the treatment group, particularly in the cerebellum, which I thought was kind of interesting, but makes sense because that's part of how we kind of perceive motor processes, how we understand what's going on in the body itself. And then some of the other sensory motor areas, for example. So basically, this kind of made a lot of sense to us that you're affecting the sensory motor area, the cerebellum, and even maybe some central areas like the thalamus and the caudate, which have to do more with sleep itself. And we were able to show that people not only seem to be sleeping better, but they seem to be cognitively a little bit more doing better. And we start to see some of these changes in functional connectivity. One of the things that is interesting about functional connectivity, I mean, this is where the brain itself starts to get super complex, is that, is it better to have more connectivity or less connectivity? And the answer is yes. I mean, it sort of depends on what's going on. If you have kind of an overstimulation of areas, then you want to decrease the connectivity because you want some area of the brain is overstimulating another area. You want to try to break that cycle. And that we see that in overstimulatory states, anxiety states, and so forth. On the other hand, sometimes you might want to augment functional connectivity so that you can create a better, cognitive processing between the frontal lobe and the temporal lobe or something like that. So it usually kind of modulates these effects, but sometimes it makes it better. Sometimes it increases it, sometimes it decreases it, but whether that ultimately means better or worse depends on how the person is doing and what the overall picture is in terms of what you're trying to study. A couple of my colleagues have been working with an interesting integrative medicine approach that is called the neuro-emotional technique, or NET. It's an interesting approach that combines a variety of elements, including things like acupressure, cognitive therapy, exposure therapy. We have seen it being used for people who have a lot of stressors. So we've done it in specific patient populations, like patients with cancer. And when they think back on getting chemotherapy or getting radiation, it just they get very, very anxious and very stressed. We've been looking at it in people with concussion more recently. We've been looking at it in people with chronic pain because even when you have chronic pain, you have the pain, but then over time you get anxious and you feel like, oh, I'm not going to be able to do my exercise, or I'm going to be in too much pain to be able to stay at work and do the things that I need to do in order to make a living and help my family and so forth. So it can kind of really ratchet up a lot of stressors. And the NET study, the NET program is something which theoretically can help with that. We wanted to test that. There's been clinical evidence that it's valuable, but does it have something physiologically that is going on that can be helpful for us to understand? And so one of the things that we did with this study, which was a little different than some of the other things that we've seen, is to do an activation paradigm where what we did was we were working with cancer patients and we asked them what were their primary stressors, and we created an audio file that described their stressors. So sometimes it would be, remember when you were sitting in the doctor's office and they came in and they told you that, the breast cancer was worse than they thought it was, and you were going to need, not just chemotherapy, but radiation therapy or something like that. So, and then they would listen to this audio file while they were in the MRI scanner, while we did arterial spin labeling to look at how their brain was processing this information. And what you're seeing here in the crosshairs where this little red dot is, that's the amygdala. And of course, the amygdala is very commonly involved in anxiety and stress. It makes us to see things that are and react to things that are stressors for us. So when we played this stressor audio file, it activated their amygdala. Then we had them go through the NET program for about 5 or 6 weeks. They went through about 5 or 6 different sessions. And then we brought them back and we did the same exact paradigm. We put them back in the scanner. We had them listening to this audio file. And now when you look at that little red dot, this is what happened when they were listening to their audio file. If you can see it, it went away. So suddenly now their amygdala is no longer, sort of play it back and forth again. So you can see where it's lit up and then it goes away. And so what the NET program seemed to be doing is now helping them to view this traumatic memory as just a regular memory instead of one that has a lot of emotional content to it. So again, just different ways of trying to look at things, think about things, and try to understand what's going on in the brain itself. We specifically looked at functional connectivity as well. So we can see that there are differences going on between the amygdala and the vermis, which is part of the cerebellum. This in and of itself was a really interesting finding that when we first saw this, we weren't sure what to make of it. As a medical student, usually what they tell you about the cerebellum is that all it does is motor coordination. But as a lot of research has been starting to develop since we did this study, people are realizing that not only does it seem to coordinate motor reactions, but it may also coordinate emotional responses as well. And this is one of the first studies that actually they kind of surprised us, but we picked this up, reported it, and then that's been part of what's been going on now. More and more people are looking at how the cerebellum is involved in our emotional responses, particularly negative emotional responses, traumas, and so forth. So not only did we show that there was a connection, but we showed that we were able to kind of rearrange that connection through this particular program, this particular practice. This isn't quite a health-related study, but I just think it's really interesting, and the images, of course, are pretty cool. So we did a study, and again, also just gives you kind of like, these are other things that you can do. So this was a study that we did of highly creative individuals. So these were people who, kind of were almost professionally creative, artists, musicians. We even included people who were like comedians who do a lot of improv, so they have to be able to create on the spot. And we are looking at diffusion tensor imaging here, so you can see all of the connecting fibers. And one of the main things that you can see where the arrow is pointing on the left-hand side is that in the highly creative people, the red fibers that are in between the two hemispheres seem to be much more robust than what we see in the controls. And we see this kind of, somewhat universally in this particular group of highly creative individuals versus just normally creative individuals. I think this makes some interesting sense, that people often talk about right hemisphere versus left hemisphere functions. The left hemisphere tends to be a little bit more analytical. The right tends to be a little bit more, spatial and holistic and so forth. So the idea that maybe the more they can interact with each other, the more creative a person can be, because you do need both. If you're going to be a creative musician, you need to understand the kind of the technical details of tone and key and time signatures and all that. But then you want to do something that's creative as well on top of that. So the idea, you may have some really creative ideas about music, but if you don't understand how the notes work and all that, then that creativity doesn't go anywhere. So the combination of the two may be something that may be very helpful. And then the question is creativity the same across different domains? If you are a very creative musician, is that the same as being a creative painter, as being a creative psychologist, who's coming up with different ways of thinking about the world? You guys, for those of you in the engineering or whatever, being a creative engineer, is that the same as being a creative musician? So we can look at these kinds of interesting questions through this kind of process. So as far as what's going on here, again, we basically launched the MRI facility, which is a core research facility here at FAU, really starting in the fall. It took a lot of time to get the whole system going. It took a lot of time making sure that we had all of the operating procedures in place. And then, of course, since no one at FAU has been doing MRI research because we didn't have the scanner, it's now kind of the process of getting everything going. And it's been exciting to see this start to develop. So right now we have 4 main projects that are going on, which have to do one with an MR spectroscopy study that is looking at a particular metabolite, NADH, in patients with Alzheimer's. We have a study that's looking at foraging behaviors. So here we have what they're doing basically. Has to do a little bit with an anthropological perspective of, when you're kind of out looking for things, how long do you stay in one spot, kind of getting all of the whatever resources that you can potentially get, and then it's time to move on. So how do you make those decisions? How do you decide when you've kind of used up one particular area and moved on to another, and what's going on in the brain? So that's kind of cool. We have neurological effects related to pet therapy, canine pet therapy. Some people in the nursing department are doing that in veterans with PTSD. So again, we can do different, types of imaging with them. We can look at what's going on in their brain, how their brain is responding to anxiety signals, and then what's happening after you go through pet therapy, and see whether or not, being able to interact with the animals might have some benefit, and what it's doing physiologically in the brain. When aphantasia are people who can't visualize things. If I ask you to visualize a pizza, you can kind of put together an idea of what a pizza looks like, but they can't do that. And so the question is, how do you look at different neural representations of visual imagery in these individuals? Does that tell us something about the visual processing, about imagination, and so forth? I think somebody asked me this question earlier, but another faculty member here in the marketing department. So again, what does marketing have to do? But nowadays they kind of make neuro everything, right? So there's neuromarketing, there's neurolinguistics, and neuroethics, and so forth. And so she's doing something very interesting about how people respond to different ways of presenting options for people. Is it better for you to have lots of different options all the time? Is it better for you to get a limited number of options, but having it always be changing, so that there's a novelty to it? So there's those kinds of things that we can begin to look at, and how does that affect the brain? Does the brain respond better or worse? And I'm also always about, individual differences as well. I mean, obviously there's some people who like lots of possibilities, and there's other people where you're like, hey, I really like vanilla ice cream, so having 31 flavors at Baskin & Robbins is nice, but it's irrelevant to me. Whereas other people are like, gee, no, I like trying this one day, and then, so it even gets down to the individual level. We have some people at the clinical research unit who are going to be doing work looking at cognitive function in people with mild cognitive impairment, which is kind of, on the road to Alzheimer's, and how that intersects with the microbiome. So obviously there's been a lot of interest in looking at microbiome effects and the bacterial content in our gut and on our bodies, and how that may have something to do with our brain's function, the whole gut-brain interaction. So we have that possibility as well, and that's a study that we're going to be doing. And then a couple of things that are coming down the pike. So one of the big things that we're going to be launching very soon is something called a focused ultrasound system. So Dr. Greg Fields, who's the Vice President of Research here at FAU, he's set aside the funds to be able to do this. So this is a special ultrasound system that's going to be kind of integrated into the MRI facility. And what it does is it emits kind of low-level ultrasound, which interestingly kind of alters the blood-brain barrier, and it allows more molecules to pass the blood-brain barrier. So the idea here, so many times therapeutic interventions are kind of stymied by the blood-brain barrier. You have a medication that theoretically should work great, but if you inject it or if you give it to somebody orally, it just doesn't get into the brain. So if you can use this ultrasound system to open up the blood-brain barrier to allow these medications to get into the brain, can it work, for cancers, for depression, for, whatever it is that you're looking for? So we're going to be looking at this particular system. And again, that has a lot of different therapeutic opportunities for different disorders. We're looking at the Karen Foundation, which has, I'm not sure if you're familiar with that, excuse me, but that is it's an addiction center that has actually a center here in Florida, over in Delray Beach, and actually from my hometown, Philadelphia. So we're talking to them about, having patients come in who have addictions and be able to look at what's going on in their brain, how do their therapeutic interventions affect the brain. And of course, again, this could have different kinds of changes depending on whether they have addictions to alcohol, different specific drugs, multiple drugs, and so forth. So there's a lot of different possibilities there. We're looking at things like that. There's the Neuro Arts program. That to me is just, ripe with the ability to how does art and, colors and music and all these different things affect our brain? How does the brain interact with different creative processes? Dr. Randy Blakely has developed the Center for the Resilient Mind. So that's going to be looking at different ways of helping our minds and our brains ultimately be more resilient. So whether that has to do with emotional processing, cognitive processing, and so we have hopefully a study that we're going to be looking at the effect of equine therapy in horses and how that may affect people's brains. I've done a lot of research looking at different mind-body practices like meditation and prayer and so forth, and how that affects the brain and may help it to be more resilient and so forth. So really, I mean, ultimately, the sky is the limit here when it comes to the ability to be able to explore what's going on, certainly in the brain. But even beyond that, I mentioned, for example, a study that we did with chronic pain. This was actually women who had chronic pelvic pain. So what we did was we scanned their brain, but we also scanned the pelvic area, looking for abnormalities, looking for inflammation. Is that affect, if you help them with sort of how their brain is responding to the pain, does that change how their body is responding? If we look at things, I mentioned the microbiome. So I've done some studies looking at irritable bowel syndrome. And we've looked at kind of what's going on in the gut and the gut motility and how that may be associated with changes that are going on in the brain itself. So all kinds of opportunities, all kinds of options, and a lot of exciting possibilities. So ultimately, again, we really have the ability here. This is an exciting opportunity for everyone at FAU. It is open to the entire FAU campus and university. It's kind of really sits a little bit in between the Division of Research, which is for the university itself, and the School of Medicine. So, whether you're a medical doctor, whether you're in psychology, engineering, even like in things like physics, I mean, there's a lot of opportunities to be able to explore ways of developing MRI capabilities so that you can look at how the MRI scanner works. It's basically a big nuclear magnetic resonance machine. And so, how you might develop new techniques, new abilities to study different aspects of the brain or the body, all within possibility here. So MRI research really can incorporate multiple areas of intersection across the university. Again, kind of the sky's the limit. So, any idea you may have probably has some intersection with the brain or body in some way. And we have the potential to be able to explore how that may happen. We can look at obviously a lot of neurological and psychological issues. So mental and physical disorders, depression, anxiety, chronic pain, fatigue, you name it, all the different body physiological changes, cardiac. I didn't really mention that. I have a study that I'm working on still a little bit with my prior institution, where we're looking at congestive heart failure. And so you can look at how the heart is beating. You can look at how the heart is functioning. You can look at the blood vessels of the heart. So we can look at cardiac function, gastrointestinal function, musculoskeletal issues, and ultimately we can look at both just what's going on physiologically, but also how different interventions will affect that. And really, whether you're a student or faculty, look forward to anybody's interest and happy to have those conversations with you. So if you are interested, myself and our team are happy to talk to you. And so feel free to send me an email and reach out, and we will. You never know what might be an interesting thing or what might come down the pike, and see where it takes us. So I think like I said, it's a great opportunity for everyone, and look forward to hearing from all of you. So I'll stop there, and if people have some questions about any or all of this, to try to address it. And that includes the folks online. I think if you're online, you can. I think you can unmute yourself. We try to set it up so you can unmute yourself. I can't quite see you, so well, actually, here, I'll stop sharing.
We may already have a question in the
We have a question in the chat. Okay. Whoop. Oh, nope, that was just. Thank you for the presentation. All right, great.
Thank you very much.
Feel free to shout out there, or anybody in here have a question or anything like that.
I have a quick question. And there are another technology, FNIRS, even though the special accuracy and resolution of fMRI is better than FNIRS, Are you thinking also have that technology? Because maybe for some application, the resolution you have for fMRI for some application is not necessary, and FNIRS is less cost than is not expensive like fMRI. And for some situation, for example, if you want to see what happened in the brain during some activity like free walking like that, you cannot measure with fMRI.
Right, right. Yeah, thank you. So, just to sort of, and you were talking about, the near-infrared imaging?
Yeah.
So the question was about, other alternatives and specifically something like near-infrared imaging or what's called FNIRS. So, no, it's a very good point. Every technique has its limitations and its, has its sort of strengths and weaknesses. So MRI has the ability to do a lot of great things, but as you mentioned, if it's something that has to do with how we begin to look at a person when they're walking or when they're moving or something like that, MRI is not going to be that useful. MRI has some excellent capabilities in terms of temporal resolution. So, one of the nice things is that you can kind of make multiple presentations of stimuli and be able to see exactly how the brain is operating, even within seconds, so to speak, and has pretty good spatial resolution, normally on the order of maybe like 4 to 5 millimeters or something in that ballpark. But again, there's limits to what that specific, we're not looking at the neuronal level. And so, as one of my old mentors always used to say, if you're a good carpenter, you have a lot of tools in your tool basket. So this is a great tool, but it can also work in conjunction with, other things that may be available here. You could say, okay, so what's happening with, near infrared imaging in a particular context, but then how does that change functional connectivity, afterwards or something like that. I should mention, and I think I started to say this, and maybe I thought there was going to be a specific slide that I thought I had in there, but the MRI scanner itself does have its own other tools. So we do have an EEG system, which is compatible with the MRI. So we could do EEG as well as, MRI imaging. We have a kind of BioPack, it's called, so we can monitor things like heart rate, blood pressure, and so forth. So there are other physiological measures that we could potentially look at. And so, and then of course, there is the whole sort of ability to do functional paradigms. So we can present visual stimuli, auditory stimuli. There are buttons that people can control to respond, or you can, listen to them in some kind of verbal response, depending on what you're interested in doing. It depends a little bit on how you want to set it up. But yeah, I mean, ultimately, my background is also in nuclear medicine, and so we've done a lot of work looking at different radiopharmaceuticals, radioactive tracers. MRI is great for kind of general function, not so good for like neurotransmitter studies. So it can't look at like where dopamine is. Even when you do MR spectroscopy, if you have a multi-nuclei MR spectroscopy, even if you can see, dopamine, it just tells you the concentration of dopamine. It doesn't tell you whether it's binding to receptors or not. So the nuclear medicine techniques where you can give different tracers that bind to D2 receptors, D3 receptors, dopamine transporter, presynaptic, postsynaptic, like you can do a lot of different things. And again, I mean, sometimes being able to do combination studies of either like PET imaging and MRI or something like that. In nuclear medicine for Alzheimer's, we're looking at like amyloid. So we don't have a way of looking at amyloid in the brain, but we can look at atrophy, we can look at blood flow, we can look at, functional connectivity and things like that. So yeah, it's a great point, which is that there are, a lot of different techniques that we have the potential to use. And this is just, one particular one that has a lot to offer, but, it does have its limitations. And part of what we would do if anybody was interested in coming to talk about a project, we would kind of, assess, well, what is your question? Is this something we can do with the MRI? We might say, no, we might want to do something different. And so, and in fact, like with our study with the equine therapy, we want people like riding on a horse. And so, we can't do that with the MRI. So, we look for other options like EEG or near infrared imaging to look at those.
Thank you for your presentation. Where is this instrument located?
So it's located on the campus here. It's in the building that's adjacent to the School of Medicine.
BC 17
It's like ME 104, I think it is, or something.
They see like signs when we're at a smaller building.
Yeah, there's a little small building over there.
Oh, okay, okay.
So, and if you ever, so the other thing that's actually a very kind of, worked out well, and I don't know, hopefully it was somewhat purposeful, but it's on the same, it's in the same space basically as the clinical research unit. So the CRU, if you walk into the building on the first floor, the clinical research unit is on the left and the MRI facility is on the right, which is also good because you could use the clinical research unit to do like near infrared imaging or to do cognitive testing or, something else, whatever your blood draws or whatever you want. And then you can walk the person across the hall and go into the MRI scanner and do, whatever imaging you want, and then they can go back. So, and some of our studies looking at things like the microbiome and so forth, you can get different laboratory tests or do different things with the combination of the CRU and the MRI facility. But yeah, it's right on campus. So it is something, it's great, obviously, access if there's like students who you might want to have. Even when I first started here, I remember there's like projects looking at things like environmental effects, like the red tide and so forth. And I'm like, well, if people have like fatigue and issues going on, let's scan their brain, like you could look at what's going on physiologically. So, but yeah, I mean, people would have to physically come to the facility over there, but it's right here on campus.
Free or?
It's not free. That's a great question.
You practice in the research?
Yeah, so first of all, if people go to, if you look up the core facility on the FAU website, you can get a lot of information there. And if you're interested, email me and I'll be happy to get to you. So the scans themselves, I mean, they are, they cost something. They're not cheap, but they're not, ridiculously expensive. Basically, the cost per scan is about $600 per scan. So for about an hour of imaging time. And so, most of the stuff that people do is done. First of all, it's hard to keep someone in a scanner much longer than that. So usually, they're in the scanner for 45 minutes, 50 minutes, and it would be about $600 per scan. So it depends a little bit on what you're going to do. So we have a new study that's going to be done soon where he's just needs a single scan. He wants to see sort of where people's brains are today. If you want to do a pre and a post intervention, or you want to follow people over time so that they're going to get 2 or 3 scans, then, you just have to multiply that out. So if you have a pre and a post scan, it'd be about $1,200 per patient, per subject. And then, it depends a little bit on what you want to do. If you're going to do extra stuff like EEG, or if you want to talk to us about analysis and things like that, there can be some extra costs for that. But, we're trying to, it's for FAU. So, we have to pay for it, but we don't want it to break the banks of people. And there are opportunities to get pilot money. So if somebody, if you said, gee, I have an NIH grant, but it doesn't include imaging, but if I can get some preliminary data, then I can apply, the next time and include imaging, then we have ways of helping you get some funding to do, 10, 15 subjects or something like that, get the preliminary data. So that then when you apply for a larger grant, you have the ability, you have that information. You can say, I did feasibility, I got some preliminary data. I can kind of do what I'm hoping to do, and now I need, the extra money to do that. So again, it's not cheap, but it's also not out of, it's not millions of dollars, but, and
For patient,
what's that?
the rate, the $600, right?
Per subject.
Is for patient.
For each subject, but yeah, I mean, it's all research. So I mean, obviously, the people who are study subjects, they never pay for anything.
If we use the small animal.
So there's going to be cost for that too. It's the same. It's the same cost. It's because it's sort of like an hourly cost.
Okay.
However, but that also, like, for example, if you can do a small, like, in other words, if you could do multiple animals or even multiple people within an hour, it's not per subject, it's really per hour. So for example, we have some people who are, I think in our neuromarketing study, which is a very brief, scan time, they're only in there for a half hour, so they can do 2 people in an hour, and therefore you're only paying half of that.
So you got to, I'm interested in, looking for some blood flow, in mouse or rat, something like that. So how high the resolution would be showing the blood flow in real time or something?
Yeah, so I mean, so there's two answers with it when it comes to the animal studies. First of all, maybe the even better news is that they are in the process of getting a dedicated micro MRI scanner that would have much, more specific spatial resolution for small animals, and that's going to be, I believe, on in the Jupiter campus. That, it's not here yet, probably like towards the end of the calendar year or something in that ballpark. Our facility theoretically can do animals. We have not specifically done them yet. So if you were interested, we'd have to have a conversation about it. It's, you're not going to be able to see, small structures in an animal. Like I said, it's going to be 3 to 4 millimeter resolution. So kind of figure that out in the context of the size of the brain of the animal. But it, it can be done to look at general changes that are going on. And then the micro scanner should be able to give you a little bit more detail when it comes to that.
The resolution is 3 to 4 millimeters.
Yeah, probably in that ballpark. Yeah.
It's much lower than microscope.
The micro one should be smaller. Yeah, probably down to like 1 millimeter or so, I believe, but I don't know exactly what system they're getting.
So the MRI is not limited just to scan brain. So for example, it can be used to scan the blood flow. So for chronic pain, probably yes, but what about acute pain? Acute pain, the subjects may be not stay as stationary as those other subjects.
Right. That really does depend. As with any imaging, you need people to be reasonably still. So, if people are, and we contend with that all the time, and whether it's because of pain or discomfort or just they don't like being in there or whatever, people can wriggle all over the place. And, because it has good spatial resolution, a little head move like this that really changes things. So, we set them up so that they're kind of strapped in there. And try to prevent them from moving and so forth. We can always look at the scans and see whether or not they have too much motion artifact. There are motion artifact correction algorithms which can be used as well. So it does depend a little bit on what's going on. If there's too much motion, then sometimes you have to just throw out the scan. But if it's something where they can stay reasonably still for that period of time, then we can get certainly the ability to look at other body parts and to look at inflammation, to look at how joints might be structured. You can look at things like blood flow and so forth. So there are different opportunities there in the body itself. But yeah, I mean, you do need people to be reasonably still.
And this scan is real time or?
Yes. Yeah, it's all real time. And so, if you're doing, like, for example, functional imaging, where maybe you want to present like a picture to people or something like that, and you want to see how people process it, you present it, and then it's taking an image, and then maybe it goes blank, and it takes the baseline, and then another image, and then you can add them all together. So that sort of block design is a pretty common thing. The other is where you actually cue the MRI scanner so that it knows exactly which stimuli are being given at certain points, and then you can kind of say, okay, capture the image here, 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 here. But yeah, it's all real time.
You also mentioned the center can provide some kind of support to get preliminary data. So that means seed funding.
Exactly. So again, if people are interested, then let me know. We may have some pilot seed money that we can provide. The Stiles Nicholson Center, the Resilient Mind Center, they're putting out little pilot grant, internal pilot grant award programs. So, hopefully that'll be something that'll be continuing, because we do want to get people involved who haven't done it before. And unless, you need to have that. So there are some opportunities to be able to do that, and we can help guide that. And then you can get, 5 or 10 scans depending on what you're trying to do. We got a question. For the Alzheimer's detection, does fMRI can detect at the very early stage? Okay, so the question here is a good one about Alzheimer's detection and whether MRI can detect at an early stage. So this has been actually something that's been a part of my career for a long time, both using MRI as well as PET imaging. The short answer is that it can be pretty useful for detecting disease at early stages and for, yes, being able to differentiate things like mild cognitive impairment to Alzheimer's and also other types of dementing illnesses like frontotemporal dementia or dementia with Lewy body disease. But in and of itself, it is also still a challenge to do that. So, it depends on how early is early. A lot of times these disease processes begin 5-10 years before a person even knows that they're having issues. There are studies that are being done looking at, people with familial predispositions and genetic predispositions. There is the possibility for doing that. And part of the research would be to see, are we able to maybe we don't see it structurally, but maybe we see it in terms of functional connectivity or something like that. Can we begin to pick that up early on in the disease? I think the answer is, generally yes, it can do that. Exactly how early is a little uncertain. And again, it's probably an area of open research, which is to figure out the best ways of doing that. And it is certainly something that we could potentially look at going forward. All right.
I guess that's all. Yeah, so fantastic presentation.
Thank you.
Thank you all, those
Thanks
people
for
who joined us
joining us there.
online.
Appreciate it. And feel free to reach out.
Yeah, we got your email.
You know where I am.
Yes.
All right. Thanks, everybody.
Can we take you to the lunch?
Was that?
Can we take you to the lunch?
Sure.
Kevin, do you want to join us? Do you want to join us for lunch?
For lunch?
Yeah.
Today? What time?
No.
Oh, no, okay.
Yeah.
Yeah, go to 50 and then
Oh,
go back.
the last?
Yeah, I'll see you later.
Yeah, thank you. Yeah, thank you.
The second one, right?
Oh, what's that?
Yeah.
Oh.
Get a mouse.
Within
Just,
5 minutes.
no,
after that.
Oh,
you
you-
need
So
to
you
end
directly go there, right?
Yeah.
Okay.
and,
But you have a great opportunity.
and meaningful.